And I said, your second lunch? She said, yeah, the doctor I used to go to told me to eat 6 meals a day. And this woman was all of this tall and all of this wide. And I said, are you sure they didn't say 6 small meals a day? That would make sense to me. She said, no, 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 no. They said I had to eat 6 meals a day. So she was having 2 breakfasts, 2 lunches, and 2 dinners. And she kept going up, 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 and she couldn't figure out why. And she said, they told me if I ate 6 small meals, I'd lose weight. So I contacted her previous provider, and of course he did tell her 6 small meals. But we all tend to have selective hearing, you know how that is. So I said to her, I said, okay, we're going to cut back to 3. And we're going to put you on Byetta. I said, because that's going to take away your hunger. You've gotten used to 6 small meals, and she did. And she says, I don't know how I'm going to do it now. I'll be hungry all the time. So I put her on Byetta, which is a new drug, fairly new on the market, to help people better control their diabetes by working on the beta cell function, helping to preserve beta cell function. And one of the nice things about it is it takes away your appetite. So we got her within 2 months to lose 20 pounds. And she thought it was a real miracle. But then she leveled off. And I said, but you don't stop, you don't give up. And as time progressed, because she couldn't walk, she said her knees hurt all the time, her hips hurt all the time, low back. You know, if you're carrying extra weight, you're going to have extra pain. But as she was progressively working towards the weight loss, I wasn't having her walk. I loan her a little mechanism, bicycle mechanism that I keep on a desk, and I had her sitting there doing this, exercising. I said, who said you have to be moving your whole body to burn calories? I said, if you're moving your great toe and you're burning calories, as long as you're moving. Sit in the chair, twist. We were teaching her how to exercise without ever having to leave her house and cost her a dime. Because the other thing I hear, I can't afford it. I can't afford the gym, I can't afford this, I can't afford that. You don't need tools to exercise. Jumping jacks, walking in place, walking around the block, you know, dancing with your children, playing jump rope or basketball. I started telling her, you have grandchildren? She goes, yes. I said, do you play with them? Wrestle with them on the floor. Anything you can to get yourself moving. That's all that's important. Burning the calories that you're putting in. The other thing we talked about was what she was eating. I started teaching her how to read her labels, looking at the carbohydrate count on the food she was eating. I said, forget the calories. Let's keep you at a maximum of 180 milligrams of carbohydrates a day. And let's divide it into 3 meals. And if you really feel you got to have a snack, then we'll cut a couple of your meals down to 45 grams, and you'll see that you lose weight. She learned. Now she comes in, I tried this, look at the label, isn't it great? They learn how to read their labels. I take people to restaurants like Furr's Cafeteria, and I don't take them there to eat. I take them there to observe. I say, watch the people that walk through the register. One man was so shocked because he watched another man start at the salad bar and eat all the way through the line and then order a new meal at the end when he got to the cashier. And this is what we're talking about. All-you-can-eat restaurants aren't good for us. Has anybody ever seen the movie Super Size Me with Michael Moore? Have you seen the excerpts? If you get the DVD and own it, there's extra excerpts after that. He did an experiment with McDonald's food. He got a McDonald's hamburger, McDonald's French fries, their chicken sandwich, all their processed foods, put them in jars. And then he had someone make a homemade hamburger and homemade fries. And they watched how these foods decomposed. As you know, you watch food, lettuce, tomato, sits out for a little while, starts to turn dark, and it eventually rots and decomposes. Well, the McDonald's burger 12 weeks later looked like the day you bought it. The French fries, a year later, still look like the day you bought them. Think about it, folks. Think about if you drop a French fry on your car floor and you don't clean your car for a while, and then all of a sudden you go, oh, got to clean the car. Oh, this looks like I could eat it. doesn't change. The chemicals are so profound, the preservatives are so much that they don't rot. Is that good for your body? I mean, it's a horrible thing for you to have to think about. But this is what we have to think about now. Don't go to these places. Don't patronize them. I strongly believe they ought to be taxed, just like cigarettes are to help pay for our diabetes problems and our obesity problems. And then maybe if people that engage in this type of habits would realize it's not good for my health, and I'm the one that has to pay for it. So think about that when you're teaching your patients. Teach your patients about this. Do some experiments of your own. Get out there in those restaurants and see. I went to a restaurant not too long ago, not to eat, but to observe, again, because it's a restaurant that's one of the very, very popular restaurants here in Santa Fe. And I purposely threw something behind the counter so I could go see what kind of oils and fats they were using to make their food, because people say, God, this is so good. Well, guess what? It was lard, Morel lard, and it was shocking. And I walked out and I said, okay, and I'll tell you who it is, Santa Fe Baking Company. It's a popular place. So think of what your pastries are being made with. Think about what you're getting. Okay, we were talking earlier. A Grand Slam breakfast at Denny's gives you this much fat. You may be young now, but you will pay the price later. This is a lot of fat. I mean, I wouldn't do this to myself for anything. It is dangerous. Think about this in your blood vessels. Where's my arteries? And all it takes is one. Think of 3. Do you want to live with a stroke? Do you want to live with a heart attack? Do you want to be a vegetable after a stroke? These are things you have to remember, think about. It's frightening.
Yeah, I've had students on the cardiac floor at UNM this semester, and we've had people in their 20s and 30s in CHF.
Uh-huh.
Some due to methamphetamine use, but a lot due to being overweight. I mean, just really large people, and also endocarditis. That's
Uh-huh. Mm-hmm.
Yeah.
Yes, we see it. Cheese fries at TGI Fridays. This is why I think these are probably the most telling props I have, because you can see how much fat you're actually getting. And these sit here. They don't dissolve. They don't melt. They don't do what olive oil does. If olive oil gets cold, it gets stiff. This doesn't melt. This is what we are putting in our arteries. And with diabetes, already with neuropathy and other peripheral arterial disease, do we want to do this to ourselves? Really? You've got to think about that. Here's Arby's jalapeno fries. The, what's that restaurant on the edge of town? Outback. Their onion, bloomin' onion. So this is pretty frightening. You know, when you think about it, even milk, I've got to find the milk one, and versus skim milk.